David McCormick. He's CEO of Vaughn Regional Medical Center and also a proud Rotarian. He's going to come up and introduce our guest for the hour. Let's give him a hand as he comes.
Thank all of y'all for coming. I think it's very important. The information is going to be shared today. Welcome Dr. Scott Harris. Dr. Harris was appointed the acting director of the Health Officer of the Alabama Department of Public Health back in September of 17, and then he received the permanent position in February of 18. He attended Harding University, then got his medical degree at University of Alabama at Birmingham, then did his residency at Caraway in infectious disease. And he started practice up at Decatur, opened up several free clinics up there to help folks with AIDS and tuberculosis and other diseases, infectious diseases. He's a volunteer physician. He's volunteered in Central and South America and Africa on medical missions over there. I've got a long list of all of his accomplishments here, but I want you to listen to him. Dr. Scott Harris is the director of Alabama Department of Public Health.
Thank you very much. I'd rather hear another song than hear me. That was terrific. It is so good to be here. I really appreciate it, and man, I just can't tell you how much I appreciate the welcome. I used to do this a whole lot before the pandemic. As you know, we've all been stuck in the house or in the office for about a year and a half. So it's very good. Let me get over here to the mic. It's very good to be out here with everybody again. So. Again, thank you for letting me be here. It's really, really good to see some of you again that I know, and to meet all of you again. I wanted just to give you kind of a brief update about the pandemic and talk about how we got here, and I'll be very happy to answer questions or whatever you all would like to talk about. I sometimes do have to remind people that the health department does things other than COVID. You might not know that. We've done almost nothing else for about 21 months, but we actually are involved in a whole lot of different things that used to take up a lot of time until COVID. As you know, we're the state's largest provider of family planning services for low-income women, for low-income men for that matter. We also are virtually the only home health provider for Medicaid recipients in Alabama. We're the ones that inspect the restaurants. As you know, most people know the health department does that. If you grew up with a septic tank like I did in Talladega County, then the health department is the one that permits your septic tank. And we still have all of these different things going on in spite of everything else that's happened. We also investigate outbreaks and infectious diseases, and we typically do that in a normal year, a non-COVID year, by looking into things like if you have a flu outbreak in a nursing home, or you have a diarrhea outbreak in a daycare. When you have lots of people who sort of get sick at one time, the health department is the one that comes in to investigate that. If you have a lot of people at a restaurant who get sick from eating in the same place. In a normal year, we do between 2,000 and 3,000 of those investigations a year. That's a normal thing, and most of those are things that are under the radar. Most of the time people don't realize how many of those we do, but we have staff that'll do 2,000 to 3,000 outbreak investigations a year. Now, what we have with COVID is we have had days where we've had over 5,000 cases per day, and each one of those is an investigation. And so when our numbers have been as bad as they've been this summer, we have had about 2 or 2.5 years worth of work per day that's coming in for our epidemiologists to handle. And that just gives you some idea of the scope of this. We've never had anything like this before. And it's, frankly, no state in the country has figured out how to do that work in a way that we would normally do it. I want to remind you just how we all got here in the first place. It was actually the week before Christmas in 2019 when the world first kind of heard that there was some kind of respiratory outbreak going on in China. It was in Hubei province, a big city called Wuhan, 11 million people. And the public health officials there said, we have a respiratory outbreak. It's associated maybe around this market. And a lot of people have ended up in the hospital. A few people have died. And nobody really knew what to make of that. But those kind of announcements aren't terribly unusual. If you follow infectious disease news, like we do in public health, you hear those things from time to time, and so we weren't too startled to hear that. But by the end of December, just really about a week or 10 days later, it became clear that the scale of this was something that we had never seen before. To give you an idea of how fast things worked, the officials who noted this outbreak had sort of figured out what virus was involved. They had sequenced that genetically so that they knew exactly all the DNA details of the virus. That was out on the internet for anybody in the world to see by the first week of January. And so in the first week of January, about 2 weeks after it was announced, we already had people starting to do tests for this virus. We already had people who were developing vaccines for this virus. So that's how quickly it happened. And looking back in the future someday, we're going to see that this is just one of the most remarkable public health responses ever. This is like sending people to the moon or building the atom bomb or all those kind of things. The fact that we went from discovering a virus, having a test for it, having a vaccine for it, starting to give that vaccine all within a year's time is just an incredible accomplishment, even though we obviously have a lot of things we wish we could take back or things we could do differently, but it really has been a remarkable thing. We started working on our vaccine effort really in earnest in about June of 2020. So about 6 full months before there were any vaccines available is when we became aware through CDC that there were going to be vaccines. And this was really a chore that we had never really had to deal with before. We do a lot of practicing in public health for flu pandemics. We get ready for pandemics, and we actually have drills, and we do drive-through clinics in flu season sometimes, which are really just practice dry runs for pandemics. But we're always using a flu vaccine, and most people are familiar with the flu vaccine, and even the people who don't get the flu vaccine aren't usually scared of the flu vaccine. And so we spend a lot of time doing that. But when we started seeing the logistics involved with these COVID vaccines, it became clearly, one of the most complicated things that we'd ever tried to deal with. So we had 3 different vaccines that were all going to come out at about the same time. They all had different schedules in which you gave them, 1 shot only, or 1 shot 3 weeks apart, or 1 shot 4 weeks apart. They were actually approved for a little bit different groups. Some of these for people down to age 16, some of these only for people age 18 and up. Some were for people who were sicker, some were for everybody. They had different cold chain requirements. The Pfizer vaccine, which is the first one that we got, has to be kept at negative 80 degrees centigrade. And there's only about a dozen or about 15 or 16 places in the state of Alabama that can even handle that product. And so not to mention that they came in different packaging sizes. So we got Pfizer vaccine in 1,000 shots at a time, and once you thaw that out, you've got 6 hours to use it, and then you have to get rid of it. And so trying to find a location that could store it at negative 80 degrees, they could thaw it out, and then use all 1,000 doses in a 6-hour period became really challenging. So that was something that we kind of had to invent from scratch. We had a lot of great partners in the state who helped us do that. We worked very closely with our National Guard. I can't tell you what a great job our National Guard is. The National Guard in Alabama is one of the finest institutions that we have in our state, and I learned that. I wasn't aware of that until we started working with these people. But the men and women in the Guard just do whatever needs to be done, and they went and picked up vaccine, and they drove trucks, and they loaded in the warehouse, and then eventually they staffed our clinics. They were given vaccine shots. We were very proud of the work that they did. Actually, here in the Black Belt, we targeted our highest social vulnerability counties, about 16 counties in central and south Alabama, and our National Guard men and women are the ones that staff those clinics, and we're very, very, very appreciative of that. We have gotten off to a slow start in Alabama overall for a lot of different reasons. One is just the inability to find places that could take the vaccine at first. To take 1,000 doses at a time, that was really challenging, and to keep it at that temperature, that was really very difficult. A lot of our problems have to do with the issues that we all know that we have in Alabama anyway. We have a lot of people in rural areas, for example, who can't travel easily. They have transportation challenges. They can't just go drive to a drive-through clinic somewhere and sit for several hours and miss a day at work and get a shot and then have to do it again in 3 weeks or 4 weeks later. Those are really difficult things for some people to do. We have a lot of folks in Alabama that just don't have a normal relationship with a healthcare provider. If they don't have insurance, they aren't used to going to the doctor. And so, if you have a question, if you have insurance and you have a doctor and you want to know if you ought to get vaccinated, you can, kind of make a 5 or 10 minute phone call to your doctor and probably get a lot of your questions answered. But there are a lot of Alabamians that aren't like that, and they don't have anybody to call. And so they have really reasonable questions about whether they should take this vaccine or not, but they just don't have anybody to reach out to. And so we try our best to fill that gap, and a lot of others do that as well. Our hospitals in our community are filling the gap in all kinds of different ways. We have hospitals that are doing just incredible work, including right here in Dallas County. So we have managed to sort of creep up from the very bottom of the pile in terms of vaccinations. Right now, we're ahead of about 8 other states in terms of people getting at least one shot. We're glad about that, although we could certainly do better. We're ahead of about 3 states in terms of having people fully vaccinated. We have about 2.1 million people in Alabama that are fully vaccinated right now. Until there's a pediatric vaccine, there's around 3.9 or maybe 4 million Alabamians that are eligible to get a shot, and we've given at least one shot to about 2.5 million of them. So we're slowly getting there. But I've never imagined that anything could be as divisive as vaccines. I mean, we just had no idea. And I guess maybe we should have, maybe we should have recognized that. The country, unfortunately, has been really divided over lots of things, as you know, for some time. There are a lot of people whose politics are how they make their other decisions in life. And so we really wish we could get people to take politics out of this. Our advice when people ask about vaccines and masks and all these other different things are just talk to your doctor. I think that's the way you get information. Just talk to your doctor, see what they tell you. Some doctors will not all say the same thing. So, they're on different sides of the issue too sometimes. But I can tell you that more than 95% of all doctors in America who've been offered the vaccine have taken the vaccine. It's very highly, there's a very high uptake among medical professionals, particularly physicians. So we have had a real tough summer, as you know, with the Delta variant. We really thought in June that we were just about over the hump. Our hospital numbers were better. We had vaccine offered in over 1,400 places. We felt like we were going to slide through and maybe make it without any more serious illness. And then in mid-July is when our numbers came up. And what happened there is we just got essentially a brand new virus we hadn't seen before. It's still the coronavirus. But it was a variant that was so infectious that it was essentially a new disease. It was like something we had never planned for before. So that resulted in, some of the worst numbers that we've ever seen in the history of Alabama. We have now lost in this state, if you don't know the number, 15,000 Alabamians. So we've had 15,000 Alabamians who've died in the last year and a half. Now these aren't made-up numbers. They're not numbers of people who died in a car wreck and had a positive COVID test. We get accused of that a lot too. These are people whose physicians certified on their death certificate that they died from COVID. So I'm from Talladega. That's where I grew up, and my parents still live in Talladega. That's about how many people we have in my hometown. So 15,000 people who are our family and friends and co-workers and church members, people that we know have died in the past year and a half. And what's really even more heartbreaking about that is that the people who've passed away in the last 6 months mostly didn't have to do that. They're mostly all people who are not vaccinated. Less than 1% of the people who died are vaccinated, at least since the vaccine's been widely available. It wouldn't be fair to talk about people who died a year ago before there was a vaccine. But since the vaccine's been widely available starting in April, less than 1% of the deaths have occurred in people who are vaccinated. So it's certainly true that people can get breakthrough infections even if they're vaccinated. We're not surprised by that. No vaccine's 100% effective. This vaccine that we have now is 80 to 90% effective. That's a really good number for any kind of vaccine. But when you have 2.5 million people who are vaccinated, even if you have 10 or 20% of them who get infected, that's going to be hundreds of thousands of people. So we're not surprised that we see breakthrough infections. But I can tell you those are rarely the people who end up in the hospital, and they're virtually never the people who die. The vaccine products that we have now work really well. The Pfizer vaccine is fully approved by the FDA. There is more safety data on the Pfizer vaccine than anything that has ever been approved by the FDA in the history of our country. Over 300 million people around the world got that vaccine before the FDA decided to authorize it, or to approve it, to fully approve it. So no medication you've ever taken or surgical procedure you've had with a device or other vaccine you've ever had has ever had that much study before it was fully approved by the FDA as compared with the Pfizer vaccine. So we still have to argue with people who don't think it's safe, or they don't know, or they can't make up their mind, and it's really tragic that there's so much misinformation out there. But we feel like we have the way to get through this. We have the way to move on and put all this behind us if we can just bring everybody along with us. So I realize that, you know, a lot of people feel differently. A lot of people are unsure. There's, again, so much misinformation. It's hard to answer everybody's questions about everything. But these vaccines that we have are safe and effective, and we feel like that's the way to get Alabama back to normal, if we can only get people to accept that. So that was some preliminary comments. I'd really like to answer questions. If you have any questions, or if you just have anything you'd like for me to talk about, I'd be very happy to do that. Sure.
Hey, thank you again for